number of uh, number of uh, methods and number of types of reviews which are in the when you look at the literature, they are available, something like this. So if you look at this tree, this is the review family tree, fine. And you can find the traditional reviews. There are rapid reviews, there are qualitative reviews, there are mixed method reviews, there are reviews of the reviews. So there are a number of ways how the literature is approached, and the inferences are uh, interpreted for different purposes. So if you look at the on the right and left side down there, you will find the uh, scoping reviews and the systematic reviews. And the systematic review, another is the specific assessment review with methodological reviews. Then we have systematic search and review, and that is something in my professional career I have, and because I'm also the editor of more than 3 journals and the chief editor of one of the journals. I've seen people submitting the articles as the title of systematic review, though they are not systematic reviews. They in fact are the systematic search and review. So there is still a lot of confusion, which is especially at the level of when you are a student of masters or PhD. Those confusions still prevail in the universities of LMICs. So for if you look at reviews, there we have systematic reviews, we have meta-analysis, of which people are very much fond of to do the systematic meta-analysis along with the systematic reviews. But it depends if you get uh, those number of articles which have this which are looking at this size effect of the size, and they are on the same treatment or same drug or same kind of methodologies. Then there are comparative effectiveness reviews, diagnostic systematic reviews, network meta-analysis, prognostic reviews, psychometric reviews, reviews of economic evaluation, and systematic reviews of the epidemiological studies. So there are, now you see it's a whole horizon. There are a number of ways you can do the reviews. So why we do systematic review? We do systematic review because we want high quality of evidence to recommend something that we want, which as an outcome which we want to recommend for better care, prevention of the patients in the communities. So, but a scoping review, as we will go further, you will see that scoping reviews are much broader, and they still leave a space for further research. While systematic reviews, they combine the research and they stress upon going for guidelines or reaching to a conclusion or telling something like this, that how this one study is better than the others, what were the reasons, the quality of the study. So the quality of research comes out of the systematic review, but for the scoping review, it gives you a handful of different researches, a literature review, which actually makes the basis for further research. So that's the basic difference that we move on and see. And meta-analysis, as you know, something to pool the effects and see that whether one intervention really works as compared to the others or not. So that is something which can come out of a systematic review, but that can also be done in isolation to the systematic reviews. So let's see what is the difference. So systematic reviews, they are comprehensive. They are the rigorous reviews of existing literature that follows structured methodology. Now you see there is a structure methodology. It's not like this that you can do it just out of any way, because it has to be a structured methodology. And why it has to be a structured methodology? Can anybody pitch in and just tell why it needs to be a systematic or structured methodology? What could be the reason? This one. Why structured methodology? Anyone? So if no one, we'll Marwa, do you want to talk? There are a lot of people, but they are quiet. I think we have 20 participants. So for systematic reviews, there has to be structured methodology because we want to cover as much as we can, but according to a criteria. There is a inclusion criteria, there is an exclusion criteria, and that has to be, and we have to minimize the bias as much as we can. So answering a specific research question is important, and that includes then systematic search, its selection, its appraisal, synthesis, and analysis of the relevant studies. What are the key characteristics? So when we are going to do a systematic review, the first thing is this: like any research proposal, we must have a clear research question or objective, so that whatever is in your mind is there, and then you form its objectives. So as I said, that there has to be a predefined inclusion and exclusion criteria. It's not, it's just like you have it in any study, any field study. You are going to do a case control study, or you are doing a randomized control trial, or you're going to do even a cross-section study. You have inclusion and exclusion criteria so that you minimize the chances of confounders, or the confounding should be not, then the confounding could be brought down. Then comprehensive search across various databases. There are a number of databases, but which are the pertinent one in which your research person is going to answer? Those are required. Then you do quality assessment of the included studies, and there are a number of tools for that. And GRADE in capital grade is one of those criteria for which is used for the randomized control trials. So there are a number of other quality assessment tools present, and you can always browse them and see in what conditions and under what prerequisite they are used. Meta-analysis, because systematic reviews are the qualitative part, but the meta-analysis is the something which is quantitative data synthesis. If applicable, if you have enough number of studies on which you can do a meta-analysis, you do it. Otherwise, you do the quality assessment of the included studies, and that's it. That is something is your systematic review. Now it's different from scoping review. Here you are doing quality assessment. In scoping review, we'll see you are not doing quality assessment. And meta-analysis is the quantitative data synthesis. You develop forest plots. You want to see the treatment effect. You want to see this effect of size. You want to clearly, through your statistical analysis, you want to tell that how many of the studies included have been able to produce any effect or any treatment effect. So the aim is to provide an evidence-based conclusion to a specific question. So that has to be, you gather high quality of evidence, and then out of that high quality of evidence, you filter out the highest quality of evidence, and then you present it in a form of an article, or in the form of evidence, piece of evidence, to the scientific and non-scientific community, to tell them, look, this one is something which is very much important, and this should be part of the guidelines, treatment guidelines, or medical books, or should be taken up by the medical boards and the committees which look into these issues, and they are made to further synthesize it and recommend those findings. So what are the scoping reviews? So scoping reviews, they are broader exploratory reviews that map the existing literature landscape around a particular topic or research area. So this is something in which you are just looking at the vast lands and you just want to tell each and everything what is there, what is out there. So the aim is to identify the extent, range, nature of existing research on topic, often to inform future research directions. So you see, it gives a broad kind of space, broad kind of land on which you can, everything is there in front of your eyes, and you see, you say, okay, fine, this much literature or information is there. From here, I have to go. That gives you an idea where to go from there. But for systematic reviews, as I told earlier, it's something which synthesizes the best of evidence and tells that, fine, this needs to be done. This study is best. This method, this study, among the randomized controlled trials, this one randomized controlled trial was done perfectly. So we can trust it. Here, you are going to tell that this much literature is available. And from here, we can go somewhere. And you just compile all the information and present in front of your readers. So broad research question or objective is there, but for systematic reviews, if you remember, there was a clear question or an objective, but here you have a broad one. Inclusion criteria are flexible, allowing for a wider range of study types. Comprehensive search, but may not be exhaustive as a systematic review. So it is like it has a scheme there, which captures as much as literature it can, but it's not that stringent. It's not that fixed one. So no formal quality assessment of meta-analysis you are not going to do any quality assessment. You are not using grade and other tools. You are not doing the quantitative analysis, just like in meta-analysis. You just summarize the findings. You discuss them and tell that, okay, fine, this much literature I have gone through and this is what I have found. So anyone who wants to do further research on that, I have summarized all the literature for him. But this scoping review is a bit systematic. It's not the simple literature review. It is systematic in the sense that it is capturing maximum. So, and in it, you can identify gaps, it can key concepts, research trends in the literature, all the things can come. And useful for identifying areas that need further investigation. So that's the major difference between systematic review and the scoping review. So now let's look at further, what are the purposes and the goals of both systematic reviews and scoping reviews, so that you become a bit clearer about these things. So systematic reviews, they focus on addressing a specific research question or hypothesis, while scoping review, they aim to provide an overview of existing literature without necessarily answering a specific question. So there is not a kind of thing that just like a randomized controlled trial or your cohort study, your case control study, your results are going to answer your objectives. Here it is not necessary in the scoping review, but it is important, and it is a must in systematic reviews. Aims to provide a definite answer based on existing evidence. It helps to identify, but the scoping review, they help in identifying gaps, challenges, potential avenues for future research. Here, the systematic reviews here, they provide a definite answer based on the existing evidence. So whatever the research question was there, it is being answered by the evidence which was synthesized through the systematic review, and it included. So when you start thinking of doing something, what do you want to do is important. The first question is this, that you want to do secondary research. Both of these are the secondary research. You're nothing doing in the field, you're not collecting the primary data. So one thing is this, that your research question is something like, you want to look at for instance, you want to see that about, for instance, COVID, you want to see that how much work has been done in Africa for COVID. For instance, take one example, vitamin D supplementation. So vitamin D supplementation, you just want to tell that your aim was to overview of existing literature, how much studies there are, how much work has been done in vitamin D supplementation to prevent COVID complications in the exposed population, something like that. But for systematic review, you want to understand whether taking vitamin D in which quantity have been more efficacious than the other, or not taking the vitamin D, or there are home remedies that they've been taken and they have. So what are the differences? And you want to provide the evidence. No, fine. Vitamin D itself, the commercial vitamin D itself, or the home remedies. There is your hypothesis. There is a difference, and you want to prove or disprove it. So something like that, and then you try to find out the studies which have been conducted on these areas and try to synthesize them. So now you are providing evidence here. So that's the difference between these two kind of reviews. So systematic reviews are oftenly used to inform clinical or policy decisions. So they are very much important that you are providing something for clinical decisions or treatment guidelines or prevention guidelines, or you want to pursue the policy decisions. You want to give them the evidence so that whatever decisions they make, they are evidence based. But for scoping reviews, they are useful to define the scope or complex of emerging topics. So it will be something like that. It gives a horizon, or it gives a broad kind of overview of what the problem is and what are the issues around whatever the disease or intervention you are looking at. So how to do the search and selection? For systematic reviews, you need to have highly structured research strategy with predefined keywords and criteria. But for scoping reviews, you can be more flexible, such you can have this strategy which is not that stringent, and you keep it flexible so that you capture more and more. But in the systematic reviews, you try to converge it, and you have the stringent kind of inclusion and exclusion criteria. Why did you do it in systematic reviews? Because you try to minimize the bias in your review. In scoping reviews, there is no such attempt, but in systematic reviews, you are trying to minimize the bias, because you are looking, for instance, at the randomized controlled trials. You are doing a systematic review of the randomized controlled trials on, for instance, on traumatic brain injury. So you want to see the effect of, for instance, tranexamic acid in the traumatic brain injury, for instance. So you want that, and you are assessing the randomized controlled trials on a quality checklist or grade criteria or some other criteria, and in which you are looking whether the randomized controlled trials were conducted without any bias, or there were some biases, whether there was no allocations concealment, or there was no random allocation of the treatment as in between the treatment and the control part. So, and for your systematic review as well, you make stringent criteria so that there is no chance of having a bias in your systematic reviews, because there is something else which looks at the systematic reviews, and that is the overview of the systematic review. And it combines and it looks at the systematic review on the same topic, and try to find out whether those systematic reviews were conducted as per guidelines, or as per the criteria, or as per the protocol, or there were some issues and there were some biases. Because whenever you do a systematic review, you need at least two persons or the authors which do independent literature search to minimize the bias. So again, systematic reviews are done with an intention to minimize the bias. Rather, the scoping reviews, they are flexible. There are no issues if you have you're not that much concerned about the introduction of bias as we do for the systematic reviews, because systematic reviews are going to produce the evidence, but scoping reviews are going to give information for future research. So through selection process based on strict inclusion and exclusion criteria, as I mentioned, and about the bias, because you have to have transparent and replicable methods, because this is important, because when you develop the search strategy for systematic review, when you develop inclusion and exclusion criteria of systematic review, the idea is this, that when your protocol is published, once you do a systematic review is published, and if somebody wants to go ahead of your systematic review and he wants to do it, either wants to repeat it or wants to do a better within another question, but using your search strategy, for which, of course, ethically, he or she is going to ask permission from you, that should produce the same similar results as you did. For scoping review, the focus is on inclusiveness rather than the rigorous selection. So for data synthesis, systematic reviews, you have quantitative data synthesis if you don't want to do the meta-analysis, and summary of findings often presenting in tables. Someone's mic is open. If you could please close it. So summary of findings often presented in tables and figures, and statistical method used to combine data for the individual studies is also mentioned. For scoping reviews, it's just a qualitative synthesis of finding. It summarizes, it focuses on presenting the descriptive overview of the literature. So systematic review is qualitative, having a quantitative part of meta-analysis. Systematic review uses tables and figures to summarize. Scoping also does sometimes, but for systematic, there is a criteria to judge whether they use the whether the included studies were what was the quality of the studies, which one is the better one, and again, if you do the meta-analysis, which one is appropriate to be recommended from its quantitative data. So this is another table which clearly explains and it compares traditional literature reviews, scoping review, and systematic review. If you see, a protocol is required in scoping review, in some of the scoping reviews, but always for the systematic reviews. Prospero registration for the review of the protocol is a must for systematic reviews. Or at the moment, not for scoping reviews. So but it is not at present. It is required, but for systematic reviews, Prospero registration is required. Explicit, transparent, peer-reviewed search strategy you should have in scoping review as well as in systematic review. Data extraction forms required in both, but not in the simple traditional literature. You see, it's all no, you can do anything. But for scoping reviews, you find mandatory critical risk of bias assessment is not there in the scoping review, but it is there in the systematic reviews. And the synthesis of finding from individual studies and generation of summary of finding is there in the systematic review. So if you are going to do, if you want to decide, this table is going to help you a lot, that what you are going to do, and it's going to be a scoping review or a systematic review. So if it is all yes, it's a systematic review. And if the risk of bias assessment is not there, critical synthesis of summary of finding is not there, if the Prospero registration is not there, so you can go for a scoping review. But your question is important. If you are going for the evidence, then it is going to be systematic review. But if you are going to for broader overview, then it's going to be scoping review. So that's it. Thank you very much. If you have any questions, I am here to answer them.
Thank you. So we'll be taking a short session of question and answer. If you have any question, Prof is still here to answer it before the next expert comes to the stage. And we'll be doing that in the next 5 minutes. Thank you.
So this session has been recorded, I think, and as you required, so it will be available for you.
All right. Prof.
Reflection.
Yeah.
Yeah.
Do you mind making the recording, the account that is making the record a co-host so that to be easy to get the recording? Thank you.
No, it was recorded by, I think, you or someone else. I just accepted it. So it should be there
Yeah,
with
like
the one who started it, yeah.
yeah, you are a host, right? So you would like to make the account that is currently recording it a co-host to be easy for us to get the recording.
You can text me, send me in the chat.
All right. We have a question on
Yeah.
the chat, so you can
Hierarchy of
answer.
systematic? Hierarchy of systematic and scoping review. But what do you mean by hierarchy? Can you explain the hierarchy? If you want to ask which one is better, is it something that you want to ask? That which one is better? Evidence-based method. So, oh, okay. So Fazali Wahid, if I'm correct to pronounce your name. Systematic reviews. Yes, Fazali. It's systematic. Evidence-based medicine, you need to have a systematic review. You need to have meta-analysis. So, oh, okay. Welcome. He is from Pakistan. So, welcome, Fazali. So, you need to have systematic review and the meta-analysis. And beyond systematic reviews, because you see, when the systematic reviews are done, I have already told that there is one thing which is overview of the systematic review, which also looks at the bias, any potential bias in the systematic reviews done. So and then the recommendations of the overview of the systematic reviews become very much important if there are issues with the systematic reviews on the same topic. And there are a number of 4, 5, 6, 7, 8 systematic reviews done on for instance one intervention, and then the then it is yeah. So and then coming out of that, the recommendations coming out of that, and it is very much important that uh, whatever the systematic review and meta-analysis has been done, uh, the the results of systematic meta-analysis are going to recommend which treatment or which evidences need to be recommended. But systematic review, it recommends the quality of the study, that this study was very good. But to look at the treatment effect or to recommend some treatment or intervention, you need to do a meta-analysis. And if the systematic and if the systematic reviews, different systematic reviews are there, and they all recommend different kind of studies, and you cannot reach to one conclusion. You do an overview of the systematic review and see which one has been done perfectly, and those recommendations then are taken into the account, and those are published. So, but nowadays you see, we also have another tier, which is the top one, which is the systematic analysis. And systematic analysis usually look at the burden of disease nowadays, and it includes number of meta-analysis, number of systematic reviews, and overviews of systematic reviews. So all the high quality of evidence is collected, and then after statistical analysis is presented for the policy decision. But for the treatment effects and the results of the randomized controlled trials, they usually go into the systematic reviews and meta-analysis, and usually level 1A kind of evidence is taken up. Thank you. Now the next question is, my team and I are trying to look at effect of food bioactive compounds on cancer management. It's meta-analysis. Compulsory for this research, we use CSP as the quality assessment tool. Are we on the right path? So, so are you, I don't know whether if you are doing an isolated study or are you doing randomized control trial? What do you want, what you are doing? Uh, that's not clear. Okay, you have done a systematic review. Okay, fine. So you have done a systematic review. Oh, okay. So you have done the systematic review and you have done the quality assessment. And you now you see you I don't know how many studies you have on the effect of food bioactive compounds on cancer management. So if you there is, for instance, there is one food compound which is important, which you think is coming up in every study, you can pool its effects in the meta-analysis and see whether in all those studies one important food compound, or you can do the subgroup analysis in which you can bring in all the food compounds one after the other. But those studies need to be of the same type. If you, I don't know if you are looking at the random, all of them are randomized controlled trial, fine, you can perhaps go for meta-analysis. But if they are different kind of studies, then there will be a lot of heterogeneity which you won't be able to control. So because the yeah, yes, sure. So I think I hope I answered your question. Right. Thank you. Thank you.